Awesome. Sorry, please continue.
Okay, so the new thing happening, unfortunately, life does just not sit there and wait for COVID to be over with. Pandemics historically are known to take up to 3, 5, even 7 years to completely disappear, wipe lives in this planet level, and or just be part of our flora that we have, our fauna and flora that we have around us and live with us permanently. So now we have a new virus infection, a new outbreak happening here in the United States and around the globe. We're talking about the monkeypox virus. And you already know that smallpox virus has been eradicated for years already with the vaccine, but now we have other zoonotic diseases happening, and it is the way we live, our impact in our planet, and monkeypox is one of them. So it's very rare to see it outside of Africa and other endemic areas, but we do have it now, started in Europe, in special communities, and this is the update that I'm going to give you very quickly about it. Up to today, July 18, we have 173 cases in Chicago. And one of the questions we get, doctor, are we having also monkeypox in children? We have the first reported case that CDC is investigating. So anybody can suffer from it, but we see it especially, mostly, but not exclusively, in gay, bisexuals, or other men having sex with men. And we see it most likely, the prevalence is on, or incidences that we're seeing is 36 years old, but it's a range. It could be anywhere 22 years old. We have seen it in younger population and now in going all the way in a range to 66 years old. And we have seen it spreading within a very close, tight community. It's a tight knit social networks, especially in those communities that were mentioned. Those are the highest risk of suffering from monkeypox virus. And so right now, the Department of Public Health, our strong message is that if you have an unexplained rash and you have been exposed, maybe having sex with somebody that it's unfamiliar, that you don't know much about, or you're in areas where the outbreaks are happening, it's never, we need to we need to err on the side of safety, just calling your doctors, making sure, getting the evaluation. And in the meanwhile, we're asking individuals that not have intimate, don't be intimate, don't have contact sex with other individuals until you're completely evaluated and the disease has been ruled out. So our testing capacity, we're actually in phase two of vaccination, and we're ramping up in terms of testing capacity. Now, it's still requested from the Department of Public Health of your locality that you get instructions, directions, and orientations around it, but we have ample capacity in terms of testing. We have the treatment available. Again, it has to be in coordination with departments of public health. These are cases that are reportable by law, and we need contact tracing to try to contain the disease. And we already have the vaccine. It's called Genius, and it's available, but it's very limited. So we're only having it for those individuals at high risk, and we call it post exposure. And for those individuals that are in areas where the disease is manifesting. So if any of our community has HIV, any other immune compromised condition, and they're having this sexual risk factors or behavioral risk factors, they can call talk to their doctors or call directly the Department of Public Health, and we will make those vaccines available. And so right now, we have received 15,000 doses are expected to come. We have provided those first vaccinations. Genus is a 2-dose vaccine right now, and it's in protocol for people younger than 18, but it's actually labeled and authorized for individuals 18 and older. So if you have a child, children, somebody that is suspected less than in our youth, we're talking adolescents, they're manifesting those lesions, very particular lesions on their skin. We highly recommend reaching out to their doctors, to their primary medical team, and or to the Department of Public Health directly at 311, or we have our phone number that's 312-746-4835, and we will walk them through through everything and connect them to a medical group so they can get the treatments that are available out there. Second doses right now are offered to immune compromised individuals but until we go into phase 3, that means that we're going to have a lot abundance vaccine. We're not providing those second or holding those vaccine for a second dose. We're vaccinated as much individuals within this definition of high risk population living or being in areas where the disease is manifesting or right now where it's surging. So that is any delays, and we're highly passing the message to individuals that any delays in getting their second dosing of the vaccine will not interfere with the immunicity that you get from vaccinations. So our strong message is if you have had physical contact with something intimate partner diagnosed with monkeypox virus and or you're sexual bisexual, you're gay, cis, trans, men having sex with man and have had intimate contact or sexual venue or getting money for sexual favors or sexual um, contact or relationships or have had any of the above multiple partners, different partners, we highly recommend that you reach out. You might be a candidate for the vaccine. And then the other important thing is to be very aware of situation and any clinical manifestation. Just reach out to your doctor or the Department of Public Health so you can get the treatments that are available. So we are seeing right now that globally we have 13,340 cases confirmed having the disease. We're seeing in 69 countries. And when we're talking about the United States, 43 of our states have already reported confirmed. We have almost 2,000 cases of monkeypox virus happening in our community, mostly related to these individuals, these communities high risk sexually and men having men sexual relationships with men. And then the other thing is that for the most part, now going right quickly into COVID-19, 75 of the United States have reported now to be in high or medium COVID community level. What that means is we're talking about cases, and the other things we're seeing in our metrics is hospitalizations and hospital capacity. Those are the three metrics deciding whether we go to a mandate or start restrictions at the hospital or even go into their homes and lock down mandates that we have seen in the past, but it's not the case. So what we know, and just to explain a little bit about what is CDC COVID-19 community levels, those are three metrics, and you can see that Chicago is nowhere near Cook County. The new way of reporting cases is by counties. So we report by Cook. And we seen there we're still under 200, but because we're Cook County, it falls into the definition of high level. And when we're talking about hospitalizations, we do everything within 100,000 population. That is the way that we normalize the reports, and we do it at 7-day average. And you can see in Chicago, we're having new admissions 3.8 a day versus Cook County 12. And then when we're talking about hospital capacity or hospital bed occupied by COVID-19 cases, we're only 3.9%. Cook County is 4.1. So we're way below that goal of 10% that poses us as low risk in terms of hospitalizations and capacity, hospitalization and healthcare system capacity. So no mandates are coming, and still we hope to see that. And partly it's because what we're seeing right now in this variant, Omicron's responses of all the cases that you see globally right now. And this variant that has now been the dominant for the most part, responsible 80% of the cases is we're talking about BA.5. Last month we had BA.2, 12. Now we have BA.5. So that tells you how quickly this virus evolves and mutates and develops this new capacity, competing capacity in terms of infectiousness. So when you're seeing BA4, the predictions by Pango lineage is that it has already reached its top. So it has plateaued and now it's coming down. That's what we're seeing. So we don't think it's going to compete against BA2, which is responsible a 12. We don't think it's posing, oh, I'm sorry. It's posing a threat to in terms of infectiousness. And now we see the BA5 might be the next one responsible of the highest surges that we might experience with Omicron, but we don't see changes in terms of virulence. It's not more lethal when you compare it to the previous alpha and beta, which were the previous presentation of variants of the COVID-19. So that is a good thing. But being so infectious means there's 3 to 4 times more infections at BA2, which we had last month. People that are vulnerable to any type of diseases are more exposed. And we're seeing that our 70 years old are the people that are leading hospitalizations and death for the most part. There is a lot of fallacies out there that children do not suffer from the disease. With this Omicron variant, we have seen the highest peak number of children and mortality related to children in terms of COVID-19 infections. And 63% of those deaths, hospitalizations and deaths, are related to children with no underlying condition. We're talking about healthy children. So that is why it's so important to have our children vaccinated. This is the way it looks. That dark green last week was less. Now we see it. It's responsible almost 80% of all cases here in the United States. We're talking about BA5. And then you see that BA4 is that light green, and BA2, 12, which was initially the dominant last month. Look what it's left of it. So it moves very quickly. This is the vaccination rate of our children right now. Our children and everybody here in Chicago, we have it by age, we have it by ethnicity. So you can see that the disproportionate affection of COVID-19 has been seen not only in the infection, but people willing to take the disease, or that we have structural barriers to this population, a higher risk. We're talking about individuals of color here in Chicago, and that we need to reach. We need to be stronger with our message. We need to be more intentional and try to get more of our individuals vaccinated. Right now, we have here in Chicago 6% of children less than 5 years vaccinated. We know that this is a group that was recently declared eligible to get the vaccine, but not much individuals are taking it, and it's not surprising. We had our parents when they survey for this vaccines for individuals or children less than 5 years old. Only 18% of those individuals said, yes, I will vaccinate my child in the United States. So it's reflected right now. The majority of the children that we have within that age group here in Chicago are Latinx communities. The same thing we see with 5 to 11 years old. And this is, you can see first dose, then completed, then boosters. As we move farther and farther away, you see that the percentage is less and less. So we have seen that 55 of our children, 5 to 11, have completed the first dose, and only 48 have completed the second dose in children that are eligible to get the vaccine. And then when we're moving to the booster, it seems like our population just don't believe in boosters. So, and then the same thing we see at the very other edge of the ages when we're talking about our elders, and in Latinx communities, we're talking about abuelitos. You see that they're falling behind in first dose, second dose, and let alone boosters. Second boosters, very low, minimal individuals have taking it. So looking by ethnicity, we see that our Asian community is a very small community here in Chicago, but for the most part has been compliant with recommendations of the Department of Public Health. See that 99, almost everybody of our individuals have received the vaccine and completed that series. And then we move and see that the next one, next ethnicity or race, moving very quickly, following is Latinx community for the most part, and our non-Latinx whites. But when it comes to boosters, then we see that white individuals have taken the lead in that sense, and when we're talking to African American community is way behind. So we're working with those individuals, with our individuals of color from disproportionately affected, and seeing those communities which are getting vaccinated, non-vaccinated, and working and allocating. And we have Protect Chicago Plus, which is one of the initiatives that we have to knock door by doors. We have canvassers, we have community leaders, trusted faces, the message very specific to kind of like increase confidence in vaccines and get our population vaccinated. So when we're talking about boosters, we have been strong with the message like it's time. If anybody that has received a primary series and it's already been 5 months, then you're eligible to receive your boosters. And we're talking about now individuals 5 years and over that are now getting the booster 5 months after Pfizer. or Moderna still for individuals over 18 years old. And then when we're talking about J&J, the recommendations is to get boosted with technology, mRNA technology, because of safety reasons. We have so ample availability of technology, mRNA technology, that there's no reason to be having individuals taking one or more dose of Johnson and Johnson. We don't even recommend individuals to starting their vaccinations with Johnson and Johnson anymore. Again, given safety. So when we're talking about second doses, who is eligible to get those second doses? Anybody 50 years and over, especially those with comorbid conditions, and anybody individuals 12 years and older with moderate to severely immune compromised condition. So there's a lot of questions about like, hey, we heard that in October, there's a vaccine very specific. It's a Omicron variant specific vaccine. Should we just wait and not take our boosters? Our recommendations, people are still dying. The infectiousness of the disease, it's at its highest. And we still see people dying. We still see people presenting severe disease and long COVID. So we know vaccinations has decreased the incidence of long COVID. Even if you get infected, it's not the same that if you're not vaccinated and get infected. And where our vaccines are the most powerful at is at avoiding hospitalization and death, especially those communities that are a high risk with low reserve, 65 years and older, immune compromised conditions. So we were talking about ways to get it. We have our clinics open. Now we have Saturday clinics. And the way we have done it is in family. We noticed that initially when we were prioritizing individuals to get it by groups of risk, we didn't see much of the uptake of the vaccine. So when it was open to the public and we were fostering environments where that were family friendly, is then when we saw the uptake of the vaccines be at its peak, at its highest. So we always voice, come in family, get into our clinics. And if you can't get into our clinics, we have Protect Chicago at home, where we go to your home regardless of your social economical status, and or your if you're undocumented, or if you don't have insurance. This is a free vaccine for everyone. And we're very sensitive in terms of the questions. Anything asked is private for HIPAA. And we don't ask those questions that put individuals at a situation that they feel threatened. Especially we're talking about undocumented community refugees. So we're very, very careful in the way that we manage the information or communication with our groups of risk. And then we have it now available for children under 5. So we can vaccinate 10 individuals at your home. And if we have any of the individuals are living where we see the zip codes, where are highly devastated communities with the lower vaccination rate, we even get incentives of $50 per initial doses, initial series vaccinations to the whole family, to whoever it is there. And if people need that support to go to churches, to visit a venue, to go to an event that it's happening, to go to a nursing home or any place that they understand that there's a group willing to receive the vaccine, we make those arrangements upon appointment. So it's open, and it's an equity approach to our communities that need it the most. And they're highly devastated, and the vaccination rate of these communities is the lowest. So we have our colleges right now. We're prepping our individuals to go to school, for daycare for parents. And we know the financial devastation is not only unhealthy and people losing jobs, losing schools if they don't get vaccinated. When we're talking about children, it's also the financial devastation. Most of the time, parents have to pay for somebody, for a caregiver to go there, take care of their children while they complete quarantine, while they're completing um, their isolation period. So the best way to go is vaccinating, avoiding those expensive, avoiding those tremendous hits. It's in when we're talking about community disproportionately affected, we saw all this happen. So this is that. I'm sorry to take so much of your time, but just wanted to give you the updates. And now I'm opening for questions, anything that you might want to know.
Oh, thank you so much, Dr. Luna. I will pass it to Natalia and Jennifer to go ahead with any of the questions that students may have.
So we do have one question in the chat box, and the question goes, you can order free COVID tests to your home by searching USPS free COVID tests. You can place 3 total orders. Each order includes 8 tests. Could we verify what the process is like and if there's any cap or limits on how many tests we can order?
Yes, she's right about that. The federal government is giving free testing. So if anybody is suffering from COVID or have symptoms, or you want to congregate or you want to travel, it is important to keep a kid at home. So we're on our third round, going to a fourth round. Individuals can get those free testing at home. You just have to go, all that information we have our chai.gov/COVID-vax. You'll get all the information. You'll get testing recommendations. We have if anybody is doing quarantine or isolation, we have our calculations directly calculator from CDC connected link there. We have all the information for free testing. So you can get it at home. We have our centers that can give you that free testing now today. So, and results within 1 hour, 2 hours when we're talking about antigen testing. So it is true. Free testing, especially a population that need it. And right now, we're not even discriminating. Anybody that goes there is going to get their free testing. Anyone that goes to our clinic is going to get a free vaccine right there. So that is true. Any other questions?
Yes, there is another question in the chat box that says, you said that monkeypox is spread through sexual contact. Is there other ways to spread it? And similarly, so all sexual contact can get you at risk?
Yes, right now we're seeing mostly in this community, but not exclusively. So anybody that is in contact with secretions, we see it most likely in this community, not because they're gay or bisexual. It's because the community is very close. It's a very tight network of individuals having close contact with each other. So that's why we see it there. But anyone can get it at any point, and we have seen it. And it's in contact with an individual for a longer time, with contact with the secretions, caressing, just hugging. We have seen it in the children that we're talking about, that individual. It's from the caregiver. So we know that there is not exclusively. So if you're in an area that it's surging, that monkeypox virus is surging, and you start seeing weird lesions on your skin, and you have exposed yourself or not, just the lesions themselves without other symptoms, we highly, highly recommend individuals to seek medical attention and rule out monkeypox virus.
We have another question. And the question goes, I'm fully vaxxed and twice boosted. Is it okay to get together with family members that are not vaccinated at all?
Of course it is. We have to keep into account that Chicago, if it's happening here in Chicago, it's high risk or high community levels of COVID-19. What this means is there are a couple of recommendations. First is get tested. If you're going to congregate, get tested yourself because you're potentially going there. And if you're suffering the disease, you can spread it. Even though we have received the maximum amount of boosters eligible by age and conditions, health conditions, we have seen that this virus is very good at outcompeting our antibodies. So, especially if you received those immunizations long time ago, it's a second dose. We have seen individuals getting infected and spreading it, even if your disease it's like very mild or asymptomatic. So we recommend testing. We recommend if you're going to go to venue, try to, or you're hosting a venue, try to make it outdoors. Indoors is a little bit more because of ventilation not be so effective. Individuals can spread the disease in there quicker than if you do it outdoors. If you're being less than contact with individuals not vaccinated, make sure that individuals going to your party or if you're there to try to protect yourself, masks, indoor masking or universal masking in public indoor spaces is highly, highly recommended, even though it's not a mandate because our hospitalization system is not compromised. But we highly recommend those. If you're experiencing symptoms, get tested and stay home. Start your quarantine or your isolation if you're experiencing symptoms. And the other thing is anybody that has immune conditions or anybody that's 65 years and over, we recommend that if you're having symptoms or experiencing or you were exposed, go early to your doctor and just share this conversation. You might be a candidate for pre-exposure prophylaxis, or you might be candidate for treatments if you're actually suffering or you have been diagnosed positive with a COVID-19 test. So those are important things to take into account in high risk.
We have another question in the chat box. It says, I've seen some questionable stuff about the Johnson & Johnson vaccine that says it harms your health. What are your thoughts on that?
J&J is still superior to nothing. I mean, individuals, we have had individuals that say, I'm not going to get a 2-dose vaccine. Just give me one, give me that J&J, despite us sitting down and explaining that is this history of clots that has been reported secondary to vaccine confirmed. Secondary is a reaction or adverse reaction to the vaccine. And then we have the other available vaccinations that we're talking about, which are the mRNA technology that we know they are safer. We haven't had confirmed cases dying secondary to those vaccines, although all the side effects are explained to individuals and it's publicly available. But when we weigh the benefits versus the risk of adverse events versus getting COVID-19 and severe phases of the disease, we know the recommendation is for vaccines to prevent diseases from happening. So that's the only reason. Johnson & Johnson is still very safe. These cases occur very rarely, but they did occur. And then we have vaccines which are safer. So our duty with the public is to inform about the options that they have. And now they have Novavax, which is coming very quickly, is a protein-related vaccination, a 2-dose serial for initial vaccination. And but we're not expecting to have that one up to maybe a month from now. So initially we don't think so, because there's 2.8 million of doses requested. So we're still planning on rolling out that vaccine here in Chicago. However, it's not one of the things that they're trying to prove, and that the ACIP met yesterday with CDC to decide the fate of the recommendations in terms of equity, is that they don't have strong data against Omicron. This vaccine was initially started clinical trials with the Alpha variant of COVID-19. So they do have some immunicity data that support the vaccination, but it's not widely distributed globally as it is Pfizer, for example, as we have Moderna. So there's a lot still conversations, and all this information I share with patients, individuals seeking another technology, because that's the thing we have. A lot of people are like, I don't like the messenger RNA technology, I want something else. So this is a good option for those individuals that are completely against vaccinated with messenger RNA technology.
Thank you. There's another question. Since more individuals are hesitant to get boosted, has offering incentives such as gift cards been a good strategy to encourage vaccination?
So actually, there's a lot happening, and it has everything to do with the political climate. Now we're having these pharmaceutical companies, which FDA has it's exclusively demanded in some way, that they have now vaccines that are Omicron variant appropriate or directed to Omicron variants, which are the next variants that we're seeing. So everybody is attentive in October to get this new vaccine, and they're like kind of like shying away from the boosters that we actually have, and vaccines still work, very powerful. So that is something that is happening a lot. Our incentives, we don't have the capital. Unfortunately, our money is very limited, so we're trying to make it for those initial vaccinations. We work with federal incentives or a money stream, money coming from the federal government, mainly at the Department of Public Health. So money is a constraint right here. If we did have that money for to incentivize booster, I'm sure we would move very quickly. But now with the upcoming vaccine, which is Omicron variant specific, we're getting a lot of hesitancy there. Like, oh no, I'm not going to get this one now, and then get one in October and November, whenever the vaccination is available to the public. And right now, 2.3 million of doses have been purchased by the federal government to this specific, including this Omicron variant specific vaccination or what they call it. It's vaccines or medications. That's the way they're calling it.
Thank you. Students, any other questions in the chat box? Otherwise, we have some questions that were submitted that we can start getting to. Okay, we have one more question in the chat box. Can we prevent people from suffering from COVID, burnout, or encourage people to stay aware of vaccines, masking, social distancing, etc.?
Yes, for the recommendations are there. We're keeping we haven't, I mean, we haven't lost the momentum. I mean, the Chicago Department of Public Health and all the health departments are strongly using every single tool that we have to message, to be consistent, to be very directed with the message that we want the public to know. And that would be in helping us with our partners, community partners, and the media out there helps a lot. So I think that right now a lot of folks, a very big group, robust folks are following the metrics and trying to see what are the recommendations of the Department of Public Health. But we do see a lot of COVID fatigue. We see a lot of people that has completed the primary series or under the definition of complete vaccination, not interested and not using mask and might think that we're over it. And because you're young and resilient, you might think that infection cannot happen, or if you get infected, it might be mild. But the one of the important communications that we have passed to individuals is that in our community of color, long COVID is very high because we're disproportionately affected by the disease. So one of the things that is important is the vaccination by itself decreases the likelihood of getting long COVID. And long COVID, for anyone that doesn't know what it is the aftermath. Once you get infected with COVID-19, what continues to happen in terms of your organs. You might get like long-term scar tissue in your lungs, and then you can't breathe. Now you're asthmatic, or you progress very quickly into emphysema, or one of the chronic pulmonary conditions very quickly. Or if you didn't have problems with urinating, all of a sudden you're receiving dialysis. Any of those are conditions and the things that we don't know. We have even COVID related dementia now that we didn't know about. People that were functional, and now after an infection with COVID, they develop some sort of memory impairment and are receiving some sort of help with activities of daily living. So those long COVID are still under study. We even have UIC right now has the recovery study happening that are highly enrolling individuals, especially our individuals of color here in Chicago that have suffered incredibly from COVID-19 and the infections, just to understand what happens afterwards, vaccinated, unvaccinated, just to see the extent of the efficacy of the vaccine in terms of long COVID. Anybody that has gotten infected with COVID-19 can enroll in those studies. And we do have underrepresentation and in terms of subjects and studies, which it hampers the ability of those studies to really give information that are applicable to our race and ethnicity. So those are important things to happen. So vaccination does protect against long COVID as well.
Thank you. We have a question from a student. Have you ever experienced a person change their mind from not getting the vaccine to getting the vaccine? If so, how did their mind change to get the vaccine?
Yes, we have. I have my in-laws and part of my family members. Don't go far. I mean, as it is, as being a community, a member of color of this community and my family as well, there is a mistrust, a profound mistrust of the government, experimental drugs, especially those technologies. Oh my God, what? So they were wanting to know more about safety, be just hanging there low and see how many people got vaccinated throughout the years to see how if efficacious it was, or if it's not going to be experimental drugs, is it going to take away my fertility. We had all of that in my family, and the most important thing is to listen to individuals. I mean, we live in the United States of America, and something that I really value of the place that I live is the choices, medical choices are up to us. And we have, we are entitled to getting all the information that we can and make those informed choices that benefits us. And I've seen those changes when individuals get the information from the right source. If they go to Google, if they go to social media, they're going to get a lot of crazy stuff like zombies walking or things like that, or your face dropping after a vaccine, especially in at the beginning of the vaccine. But now you see that more people are open to consider it. More people are open to inclined to get it, when you see that the mortality statistics are speaking against those with low reserves, our abuelitos or families that initially did not want any of their loved ones getting vaccinated, they're more prone to get vaccinated. So we're expecting now that going back to school, we're going to have a uptick of the vaccine in our population, pediatric population, and then hopefully in October and November when we get the Omicron variant specific vaccine, then we can get our population completely vaccinated.
Thank you. Another question from a student. How many days should you have for isolation for COVID-19?
So the recommendation still is 10 days for individuals that can do it, but since CDC is aware and put science to reality, we have now the shortened quarantine isolation guidelines, which is it was designed to minimize the impact of school interruptions with schooling, with works interruption, decrease interruptions of essential services provided by employees. So one of the thing is that if you're in isolation, which means you're infected, whether you're vaccinated or unvaccinated, it doesn't matter. You have the disease right now. Their recommendation is 5 days for those individuals with isolation, with the last 5 days masking if you can't really complete a 10-day period of isolation. If you can't complete a 10 period isolation being at home, the recommendation is stay at home. And one of the important things is that you have to be fever free for 24 hours, and your symptoms have to be resolving for you to consider recuperating from COVID-19. We have had individuals that has a lingering disease, and really it's not recommended for you to join the working force, to go to school, to spread this further than where it is. And then for those individuals doing quarantine, those that know that are exposed, somebody living at home with COVID-19, and that you know that you have been exposed and you're vaccinated, it makes a whole difference that if you are vaccinated. So if you're vaccinated, you don't have to stay at home. You can mask, strictly masking for 10 days and be out there out and about and be attentive by day number 5 doing your COVID testing. If you develop symptoms, immediately go home, start isolation and test. And if you don't have a vaccine, oh, I'm sorry. The recommendation is that you do get, you stay home doing your quarantine for the 10 days. School is different. School does have like there is test and stay, which you can start testing every day or every other day, like 2 days, 3 days within the exposure and stay at school with a mask, of course. And then we have other type of arrangements difference, but we do recommend doing those quarantine days for those individuals for 10 days if you're not vaccinated. And then, or 5 days at least, if you're not vaccinated, completing with 10 day with the mask, if you're symptom free, and test by day number 5. It's very important.
Thank you. Now regarding some of the questions that were submitted beforehand, we do have multiple questions regarding the new variant, so I'll summarize and merge them together. So should we worry about the new variant? How do we know if we potentially, so if we caught COVID, could we potentially give somebody else the new variant? So a little bit of how do we understand like what variant we may have gotten? And then thirdly, are we going to get new vaccines that cover the new variant this fall?
Yes, and that is so true. With the new subvariants of the Omicron, we know they're more infectious than ever. So we're talking about individuals, even vaccinated individuals getting infected, but that is not the rule, it's the exception. So vaccines still do protect against getting infected. So the important thing with this new BA.5, it has taken over the world, is a dominant variant, outcompeted everybody else. And B4, initially we were chasing after BA4, and but now we think that it has plateau. So it was never at the same position that BA5 in terms of competitiveness. So what we do know is that for October, there's a mention already from our pharmaceutical companies that there is Omicron variant specific vaccinations on their way. But we don't know much about that. CDC is keeping us abreast here at the Departments of Health. giving giving news, giving updates, but we don't know like the clinical trials, the specific how efficacy, the efficacy has tested. And so those are incredible specific things we don't have yet, but we know it's in the works. And meanwhile, we highly recommend individuals that take, if you're eligible to get your boosters, just get it. If you haven't finished your primary series, finish your primary series. There's no reason not to. It's free, it's for everyone. Just call us, call 311, and you'll get an appointment, or you'll get oriented or directed to the place that you need to go. But the important thing is that you get that primary dosing. We're waiting for that one that it's coming. It's Omicron specific. We hope that it's better at preventing infections, but the ones that we have right now are very, very good at preventing hospitalizations and death and infections too, even with this new BA.5. So that is happening. It's always worrisome when we have something identified. Now we have a BA 2.17. So, 7, I'm sorry, 2.7. So that one has been detected in Africa. It's moving very quickly. So once we get those heads up, we know that there is a potential it might become the subvariant of dominance. So we're chasing after it. They don't change too much. That's why you don't get a different denomination. It's still Omicron. Once the changes are important in the spike and the nature of where it is, where it was, then they get a completely different name for it. So it's still the same one with different variations and acquiring different competitiveness, different things, infectious, and being more infectious every time. But it's still Omicron.
Okay, I have one question for you, Dr. Luna. So you talked about the Protect Chicago Plus program, and funnily enough, I actually wrote about that program as I'm a Master of Public Health student currently right now at UIC, and I wrote about that program for one of my courses, specifically its impact on Inglewood. But I'm curious to know, do you see programs such as that taking on different initiatives like past COVID-19 vaccines, such as like the flu vaccine or even the monkeypox vaccine? Like, what do you see the future for a program like that?
Yes, and this program has been incredible in bringing out those inequities that we see, those social injustices that bringing it out. It's very loud, and in terms of this disproportionate affections of some population and others not. So I foresee that right now the city is moving. It's still very much COVID, and it will continue to be until it is not, but we're moving into what it's the equity zones, and it's bringing not only COVID infections, medical, but financial. Remember that well-being of a community includes the physical, mental, and financial health. So those are very important for communities to thrive independently, to be moving everything, moving the needle in terms of our productivity, our money, our capital, our investments in, and achieving all that mentally, financially, and as I mentioned, most importantly, or as importantly as everything else. So there is money, a lot of money coming. There was like millions of dollars designated. It was $89 million designated just for mental health. So we're talking about, we just launched that was nationwide 988, which is the mental health lifeline right now in a crisis, use of opioids. So that was launched in every language. So if you call there, somebody, a group, a trained group will attend your needs in the language, in the culture that we need individuals to get the information, to make those choices if you have suicidal ideations. So it's coming in that way, and we know the violence of our communities is something that it's keeping us, all this happening with COVID. It's just a channel that it goes, and you see incrementing anxiety, violence, of financial devastation of COVID-19, aside from where we were initially, even before. So there is a lot of those conversation. Everything is on a lens of equity. There was recently the a racial equity rapid response team together with city folks, and they talked about the loss, life expectancy loss by race, ethnicity in Chicago 1 year after COVID-19. And surprisingly, we saw the steepest fall was for a Latinx community, and the widest fall in life expectancy is for our African American community. So there is a lot of things when we're talking about mental health, mental health, no, overall health in all its forms and well-being of the population and keep the population healthy. So there's a lot of that. Protect Chicago Plus is just the initial steps of something that we foresee. It's going to be the way that we approach a diseases, we approach our situations here affecting any of the ways of our health in our communities.
Thank you. We have one more question in the chat box. Do you believe COVID is transitioning from a pandemic to an endemic? Is that a good thing?
Yes, still pandemic. We're expecting it to be endemic anytime now. As the flu, influenza is endemic to the United States, and there's other viruses that are endemic too. The thing with COVID-19 is that we saw these levels in which it really, really threatened our healthcare systems and the way that we live. It devastated our financials also in Chicago. So when we're talking about, and a lot of people is like, why COVID is not, why not monkeypox? It's right there. We're surging. Why is not that a pandemic? If everybody in the globe is experiencing it right now to one degree and another, 69 countries. But it's not because of the level of devastation that we're seeing. We're seeing an outbreak, important outbreak, but it doesn't meet those definition of a pandemic at the level that COVID-19 did. And after we look at them, the potential of continuing these conversations and prolonging the pandemic. So there's a lot of things that we try to say. Even we had one of the questions asking, like, why don't we give the vaccine to everybody in the community, like the Genius vaccine for COVID-19 for monkeypox virus, if it's surging at different places. But since we see it directed to certain groups, which is a difference than when we see COVID-19 that indiscriminately was affecting everybody and disproportionately affecting those at higher risk, then it makes no sense to have like global approaches, like everybody get vaccinated now. But phase three is going to have those individuals, like anybody that is men having sex with men, for example, to receive the vaccine, even if they're not in communities that are surging or where it's in monkeypox virus is quickly spreading. So this is the way that we foresee our infections happening here and other conditions that we suffer here in Chicago and at a public health level.
Thank you. Alrighty, to end today's session, could you share any advice for any pre-health students who are aiming to pursue either a career in public health or in medicine? Any words of advice you can give to our students?
Yes, we have a significant shortage of our public health providers, and most importantly, underrepresentation. This pandemic, I mean, the COVID-19 pandemic has shaken the very foundation of where we thought we were. Unbelievable how lack of people that look like me, look like you, has made the difference as to just for vaccination. A confidence, for example, just to be in a position to receive the information. So we see it that it's impacting. I mean, we have like a shortage of doctors, public health providers, and a lot of and everything. We're underrepresented. People of the color, like us, like me, are underrepresented in every single career. But I think there are places where vulnerability is at the highest when we don't have our healthcare providers being there, and we don't have enough as it is. For example, right now we have in the Department of Public Health 5 positions for doctors, medical director to help promote and direct its strategies and initiatives to positively impact our population. And when we're talking about every single other place, leadership, making differences, our legislation makers, policy makers, we really have a scarcity that is it's incredible in every single position of our careers in terms of individuals of color. And when you come to the very end, it boils down that you see that our charts, mortality, hospitalizations, mortality are being led by people of color like you and me. So I think that this, I'm putting it out there. There is a need, there is out there. Really, we need our healthcare providers, we need our nurses, we need our doctors, we need our public health providers. We just need, and it's not enough. So anybody, we're more than welcome. We have pipelines to expose you to see if this is might be something that can change the way that you see yourself in a career here in the United States. But it's very rewarding to see it like reflected in our population. It's very rewarding to me as a Latino when I see the needle moving and more are people protecting our children, protecting our elders right there in the community. So I can't stress it enough. We need you. We need you now. So just take the steps necessary and come and join us.
Wonderful. Thank you so much, Dr. Luna. On behalf of Champions, we are very grateful for you and for all the advice that you've given us and information. Students, please join me in thanking Dr. Luna, and I will hand it over to Timo.
It's been an honor. Thank you very much for having me.
Yes, the comments are flooding in with thank yous. But yeah, no, thank you for joining, and we will go ahead and end here. But yeah, I think we can go ahead and end here. I will stop the recording.